Well, Central Indiana Funeral Home has sent a fourth of its staff home as concerns grow over the spread of COVID-19. News 8's Richard Essex talked with those workers.
In the past 2 weeks, at least 7 people have been brought to this funeral home after they are suspected of contracting the COVID-19 virus. In the coming weeks, the funeral director expects more people to come. She hopes that her staff will be healthy enough to handle the surge. 4 people that work at this funeral home are in quarantine. This morning, a member of the staff was running a high fever and sent to the doctor. At the beginning of the workday, everyone on staff is checked for symptoms. The brick building at the far end of the Indiana Funeral Care parking lot is almost full. That is the morgue. Right now, there are 2 people in the morgue that died from complications of the COVID-19 virus. The virus was most likely carried into the facility by family of the deceased. They are not allowed to have more than 10 people in the building at a time for services, but it only takes one person to infect several. Funeral homes are considered to be an essential business, which gives them access to personal protection equipment from the health department. But getting the staff tested for the virus has proven to be difficult.
We have people that don't have doctors or primary care physicians, and because of that, we can't get them tested. And then when we can possibly get them tested, it's send them to the ER, which is exposing more people that we're trying not to expose. So why is it that we have to wait?
The funeral home has 12 people on staff. With 4 out, they need at least 7 for normal operations. The coming weeks could be anything but normal. If funeral homes have to send staff home because they have tested positive for the virus, it could mean that funerals overall are going to have to be delayed. In Indianapolis, Richard Essex, Wish TV, wishtv.com, and follow us on Facebook.